Hello everyone, my name is Amina, and in this presentation, I'll be introducing you to pacemakers. A pacemaker is an implanted electronic device that helps control abnormal heart rhythms. It works by sending small electrical impulses to the heart when the heartbeat is too slow or irregular. Pacemakers are commonly used to treat conditions like bradycardia, where the heart beats too slowly, AV blocks, and sick sinus syndrome, which is when the heart's natural pacemaker isn't working properly. Let's look at the three main types of pacemakers: single chamber, dual chamber, and biventricular, also known as CRT. Starting with the single chamber pacemaker, this type uses just one lead. It's placed either on the right atrium or the right ventricle, depending on the patient's condition. Next, the dual chamber pacemaker, which is used two leads, one in the right atrium and one in the right ventricle. This allows the device to coordinate the heartbeats between the upper and lower chambers, providing more natural rhythm control. Finally, we have biventricular pacemaker, also called cardiac resynchronization therapy, or CRT. This uses three leads, one for the right atrium and two for the right and left ventricle via the coronary sinus. CRT is especially helpful for patients with heart failure because it synchronizes both ventricles to improve the overall heart function. It is important to note that dual-chamber and biventricular pacemaker offer more physiological pacing, closely mimicking the heart's natural rhythm compared to single-chamber devices.
The case study summary. This study looked at the effect of two types of pacemaker on the heart. So the first is single chamber VVIR and the dual chamber is DDDR. So this is to aim to see how the pacemaker affect the left ventricle, which is the heart's main pumping chamber, and also how they impact the quality of life of the patient. For the key finding, dual chamber pacemaker, the DDDR pacemaker was found to have less negative impact on LV function and keeping the heart pumping more efficiently, and also improve quality of life. Patients that using the dual chamber pacemaker reported to have a quality of life over the time, while the single chamber pacemaker VVIR has a negative effect on the heart function as it caused a more noticeable decline in the LV function. The heart wasn't pumping as well after a few months, and it also still improved the quality life, but despite the heart function decline, patients still felt better in their daily life. To look more detail on why dual chamber pacemaker are better than single chamber, this is because it has better synchronization. They have the heart's upper and lower chamber beat together, improving efficiency. So it is basically AV synchronization. And for second is protect the left ventricle. Dual pacing prevent damage on the left ventricle, which pumps blood to the body. And the third is more efficient. It helps the heart fill and pump blood more than single chamber pacemaker. And lastly, fewer complications, as the dual chamber pacemaker reduces the risk of heart failure and stroke.
So for the complications, left ventricular dysfunction. Second, reduction in LV ejection fraction. Third, deterioration of diastolic function. Fourth, heart failure progression. Fifth, atrial fibrillation. Sixth, stroke. Conclusion. This study concludes that while permanent pacemaker implantation improves patient quality of life, right ventricular pacing, particularly in single chamber mode, has a negative impact on left ventricular function over time. For dual chamber, pacing better preserve heart function with lower rates of complication such as atrial fibrillation, and stroke. Therefore, the dual chamber mode is considered the more favorable pacing option for maintaining cardiac performance and achieving better clinical outcomes.